Hi everyone, good afternoon. We have a patient for a tube placement via esophagostomy, percutaneous esophagostomy tube placement. This patient is diagnosed with a acute um, tick-borne disease. Which one? Anaplasma? An ehrlichiosis. Presented today with a epistaxis or bleeding from the nose. And since this patient is very aggressive and or very much anxious and intractable, the owner were not able to provide the medications um, as the same with us. We cannot give the oral meds because this patient seems like have a different behavior, is not sociable and aggressive. So to avoid from injury from our staffs, we need to place a feeding tube, not only for enteral feeding, not only for nutrition support, but also for medications. So we can place a different tube by, like for example, for nasoesophageal or nasogastric, but the drawback with nasoesophageal tube, it's very small tube, and some patient does not tolerate with the tube on the nasal cavity, and it causes irritation. The nasoesophageal or nasogastric tube is only for short period of time, maybe around 2 or 3 days, and we can only use liquid diet. So that's another one or another disadvantage with nasoesophageal. So with esophagostomy tube, we can use larger diameter tube, maybe around 14 or 16 FR or maybe larger. With esophagostomy tube, we can use or we can give a blunt or even canned food, blenderized food, because of a larger tube diameter, and it is for uh, longer uh, period of tube feeding, no? Unlike esophagostomy tube. Okay, so here we prepare the patient. It's already under anesthesia with a gas anesthetics. We use isoflurane, and we pre-medicated with combinations of opioids and some sedatives. And he is positioned with the dogs lying on its right lateral recumbency, and this is the clip area here. We prepped with chlorhexidine, and the same with other patient, like in cats. We need to avoid the jugular vein in this area. Okay, so I'll just prepare my uh, gown here, Lon. Ilang bigger tube yan?
18, 16 lang po.
60 yung malaki.
Some owners are reluctant to have their pets being intubated for tube feeding, or esophagostomy tube because they are uh, maybe scared of the procedure, and it looks like a uh, a hassle, or like a not usual, but not usually done in veterinary, but in some studies, it shows that early nutritional support in patients, especially with some metabolic disease, infection, sepsis, it doesn't only support for the caloric needs of the patient, but also modify, or can nutrition can even modulate the disease. It means that it can even um, reduce or modify the pathogenesis of the disease. Patients with infectious disease are highly uh, at risk of developing malnutrition because of the so-called what we call this, what the so-called stress starvation. Most pets brought to the clinic are actually malnourished the time they were admitted, because most of these pets were not eating for a few days before they were brought to a vet clinic for nutrition or for treatment. So um, further further weight loss, further uh, anorexia will even lead to immunosuppression, delayed healing, increased morbidity and mortality rate among hospitalized patients. Okay, and blade number 15. Yeah. Here's our tube. This is a silicone tube. Yeah, we will measure the tube. It's too long. Tayo nyo gamitin yung ano ko. Wait. Puputulin na natin. Ano yan to? Nakalagay. 60. So 60, lahat maya. Then until here. Okay? So, pasok muna natin. Then, pasok doon. 60. Okay, 60. 60 centimeter. I think there's a jugular here. Not? Jugular. That one. So our tube will be placed on this side here. Just one. Okay. I need to cut my tube. It's too long. 60. 60, 60, 60, 60, 60. So that's my tube length here. So there. Okay, 60. That's my tube length. So the tube can be removed after minimum of 2 weeks. Baba mo na ulit. Yan. Then, check for nuts here. Yan. Move mo ito. Yan. That's it. Kumusta ang platelet nito?
200 plus.
Okay. That's the this white tissue is the esophagus clamp. Oops. Okay. Yeah. 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 Lang dito kasi masikip. Because it's a silicone. Then burst. No. Remove. Sabi ko na. Tanggal. Hawak. Hindi ka naka-gloves ka naman. Yun dapat nakalabas ng konti ang tube, hindi yung pasabay sila. Then make sure na yung mo hindi sasabit sa any structure, the endotracheal tube or iangat mo yung bibig. Yeah. Then yung tube, your long forceps, make sure na hindi siya sasabit pag mo. Yeah. Nakaligahad yung mo eh. Siyempre rin ang pasok. Huwag muna yan, yan, okay. So, dito lang. Huwag mo bitaw ha. Huwag muna ha. Okay. Then, release. Huwag muna hatakin. Hop. Parang nadala mo yata. Yan. Okay. Sige, hatak ko na yan. Okay. That's all. Okay. So another indication of tube placement or tube feeding is for patient with some forms of oral malignancy, or if there is lesion in the mouth, the patient can't be able to ingest or to eat because of the painful lesion on the oral cavity. Another indication is when there is expected anorexia. For example, when we're going to perform a very extensive or painful procedure that anorexia is expected, and if the dog was not eating for a couple of days, or when there is sepsis, there is severe infection, there is a malnutrition, or when there is a decrease of body weight for about 10 to 20% weight loss. So those are indication that a enteral nutrition should be applied or should be considered in patients with those kind of conditions. There is actually a difference between a healthy dog that is not eating, what we call that, just like in human, we call that a healthy starvation, as many individual nowadays who are very much uh, aware of their weight. Um, they are into a weight loss program. Many people are very much concerned of their uh, energy intake. So they were having some program with what is called intermittent fasting. It is okay for individual, even in animals with healthy condition, but for patient with the certain types of disease or during the disease process, there is a so-called stress starvation, infection, inflammation can trigger release of some hormones and cytokines that leads to breakdown of proteins or muscle and lead to further malnutrition, immune suppression, and prolonged healing. So it is important that a patient receives the right amount of calorie, the right amount of proteins, amino acids, and phytochemicals in the forms of antioxidants, vitamins, minerals before severe complications associated with malnutrition develops. We have also experienced in dog and puppies with parvovirus. Parvovirus is an infectious disease caused by the virus parvo, viral infection, causing deaths among puppy due to a severe hemorrhagic gastroenteritis. So, puppy with parvo, when early nutritional support is considered, death and mortality or morbidity rate can be reduced, because one of the complication with parvo is that it causes bacterial translocations in the GI tract. One is the damaged villi or intestinal mucosa, and second is when the puppy is malnourished already due to a anorexia. Bacterial overgrowth also can occur, and translocation from the intestinal lumen to the circulation, causing endocarditis and other associated complications. So, with parvo cases, we have experienced puppies that recover faster compared to those who are not receiving enough nutrition or enteral feeding. So it's part of our routine to place a feeding tube, specifically this type of tube feeding, which is esophagostomy tube placement, because it can be used for many weeks, even more than a month, because it is safe and for longer duration nutritional support. Okay. Next is to use this here. Paano to ulit? Ron? Ano muna? Ito muna o ito? Ito muna? Ito muna? Tagali ko muna ito. Ilalim. Tapos, pwede ba natin i-ganon na ito? Yan. Tapos, saan ito? Okay. We are using this for few times, so I'm still not used to place the protection. It protects the wand actually from fluids and from no? Oh. Okay. Moisture and contamination. Good. Good. Lagyan ko pa ng cotton padding, wadding sheet. Here. Pwede mo lang ulan to. Hangat, hawakan mo yung ulo niya. Okay, hop. Okay, let's zoom out or camera. Okay. Yep. Okay. We can start our first feeding by tomorrow, and we can include also the medications. It is also another thing to emphasize is the advantage of enteral nutrition, enteral feeding, or esophagostomy tube is that we can also give some medications, just like with the case of this dog. This dog is diagnosed with a ehrlichiosis, so this dog is difficult to manage, and we cannot give oral medications as well as the owner. So available antibiotics for ehrlichiosis is only in tablet forms. We can. It's very it's not common for medications for ehrlichiosis available in other forms, like in injectable forms, because of the it's very painful when administered either by subcutaneous or by parenteral nutrition. So antibiotic of choice for ehrlichiosis is a doxycycline. as most vets use in their practice, but it is only available in tablet forms. We have injectable forms before, but it's very painful. It causes inflammation, severe pain on the injection site. So we stop using injectable doxycycline. So with dogs like this, it's very difficult to handle and aggressive and can cause might cause a
Post
harm to our staffs and to the owner. So it is a good option to place a or to provide a tube feeding for for nutrition, not only for nutrition but for the medication also. Thank you. Thank you very much for watching, and hope that you get a little information about this procedure. This is esophagostomy tube for enteral nutritional support and for medication. Okay, that's all, and thanks for watching.